everyone. Welcome to our next session. This includes CEOs from US-based NGOs speaking about the future of global development. Yesterday, we had a parallel session with NGO executives based in Africa, and this really highlighted the importance of this topic and something that the global development practitioners feel very passionate about. So I'm really looking forward to this conversation. I'll turn it over to Akhtar Badshah, who is a Global Washington board member and author and senior lecturer at University of Washington to kick us off. Akhtar?
Thank you very much, Kristen, and good morning, good afternoon, and good evening to everybody that is joining us. For those that you were part of a sister panel yesterday, you kind of got to hear from local voices. And today you're going to hear from three amazing individuals leading three organizations that have had transformational impact on all of us and the development sector. Let me just, to start off, just summarize the conversation from yesterday. What was very fascinating is that our three colleagues from Village Reach, CARE, and the Hunger Project emphasize this whole aspect of locally driven and globally connected. The other piece that came about very strongly was this whole issue of community-led and proximate leadership. The other focus, which I thought was actually very fascinating, was let's not solve problems. Let's identify the strengths in the community and amplify it. The other big issue was the issue of having trust. Trust in the ability of local folks to drive for decisions that's in the best interest. But yet there was this emphasis on the global connectivity and the global connection, so you don't miss out on these massive changes that are happening all over the world that are also critical for local impact. The other piece was this whole issue of power dynamics as to who holds the purse strings and how effectively that purse strings are being decentralized. And finally, there was this reminder that during COVID and at the height of COVID, it was the local leadership, the proximate leadership that stayed in the community to help the community because they had to be there. So just those were the conversations we had. And with that, I would love to invite my three guests to join us. Turn on your screens, unmute yourself. Janti Soeripto is the CEO of Save the Children. We all know what Save the Children does. It's just an organization that has had tremendous impact. Nikolaj Gilbert, our local institution CEO of PATH, and of course, my dear friend and colleague, Atul Tandon from Opportunity International. I'm not going to introduce them. Their bios are up on the website, and you really all should know these individuals and the impact that they've made in the world, so they don't need any introduction. With that, I'm going to dive into our first question. As we talk about this whole issue of decentralizing leadership, over the past few years, your organizations have done an internal examination and committed to decentralizing leadership to improve programs through country-led design. What are a specific impetus at your organization to drive this internal review and change process? And I'll start with Janti.
Thanks, Akhtar, and really wonderful to be here, and such a great, important topic. I love that summarized insight from the previous panel about locally driven and global connectivity, and that really speaks to me and what our organization is trying to do. The impetus to to start looking at this was actually very locally driven through our country teams, but also the partners that we work with. I would start by saying we have to be incredibly humble and recognize that we are far from perfect on this topic, and I think I would even argue internally that we're really at the beginning of trying to understand where we are doing where we're making progress and where we are almost, I would say, unconsciously incompetent still. So I would argue we're probably still coming out of the phase of being unconsciously incompetent. And if we get to consciously incompetent over the coming months, I'd be happy, I think. Save the Children has been around for over 100 years, as you know, and through some of that work, I mean, some of our best work, some of our best inventions came from very locally led innovation. When I joined this organization and the sector, the first thing I read about was positive deviance, which was essentially invented in the 60s, because Save the Children staff looked at how communities, actually in this case in Vietnam, were able to provide nutritious, to have kids in the community that were better, that had better nutrition than others, even though the circumstances seemed the same. And in the end, that led to positive deviance, and we now use that globally in many forms of interventions. Even here in our US programs, in this beautiful state here in your backyard, we have moved some of our early education work very much based around the school system, and we now move that into being really within the Quinault tribe in the western part of the state. And again, but we had to force ourselves to get away from the idea that we had to control the design and the implementation of that work through something that we knew, which was the school system, and really let it be led locally. So I think Save the Children is really at the beginning of that journey. I would say that we are consistently inconsistent in how good we are and how we apply that. We're looking at 7 dimensions of localization to try to be as specific as we can about these things. We're looking at the funding that we provide. We're looking at the partnerships that we have and what kind of partnerships they are. Are they transformational and strategic, or are they very transactional? We're looking at governance and accountability. We're looking at policy and visibility for those partners. We're looking at participation in how we design our interventions and then lead them. And we're scoring ourselves on each of these dimensions to see where we are. And I would say in most of these, if not in all of these, we are really at a very early stage.
Janti, I thank you very much. I really love this issue. I mean, how you stated it, that we are at this unconsciously incompetent stage. And if we can get to being consciously incompetent, that is going to be enormous progress. So I really love that. And that this whole issue of locally consistent innovation. So thank you very much. I mean, I think this is clearly, Save the Children has had, over 100 years of experience in partnering with local communities to bring about change. So thank you very much for your perspective. At some point, I hope that we can broadly share these 7 dimensions of localization that you very quickly touched upon, because I think they're very fascinating to dig deep into. Let me move to Nikolaj and have him share, the work that Pat has done.
Well, thank you very much, and it's a great opening question. Obviously, the topic we're discussing today is not a new topic. It's a topic that has been relevant for all of us to engage in for decades on how we create a better sector and how we create more local ownership and empowerment in our organizations. I joined the organization in January 2020, right at the start of the pandemic. So as part of joining a large organization like PATH with close to 1,000 people outside of the US working in countries, the first thing that I think is important is to start to listen. And as we listened, And I listened to our staff, our colleagues, our partners, ministers of health, local NGOs, development country manufacturers in vaccine production. All the message is very clear that there is a lot of expertise that has not been acknowledged for a very long time, locally and in country. We also, as part of this process of understanding and listening, did a DEI survey within our organization, but also coupled that with a partner survey where we spoke to people in more than 40 countries around the world to really understand what are some of the major challenges and changes that we need to make as an organization to show leadership, as we have that responsibility. I think organizations like ours, Janti, who are large and who has been around, we've not been around for 100 years, but we have been around since 77. So we have some responsibility to try to actually change things. So from all of these listening sessions, it became clear that we were not doing enough in terms of empowering decision making. So we had to make some changes in our structure to create a more regional and country-based leadership, organizational changes in the structure, including who is in the executive team and the voices and so on. So that was made last year, some significant changes compared to how we were organized before, and based on that feedback. But we're just at the beginning now. Our mission is health equity. And if you look at the pandemic and how it has affected all of us, and you mentioned this as well in your introduction, Akhtar, that during COVID, local decision-making, local knowledge, local country insights, every country has had their own pandemic and their own variants and mutations and so on. And we need local people who understand the context to make the decisions that are needed to address a pandemic. And we work in infectious diseases where we deal with a lot of different pandemics, not at the scale normally, but that local knowledge is essential for working on health equity and in the sector that we're working in.
No, this is great, and it's this whole ability to listen and listen to multiple voices, but then go beyond listening to it to actually integrate that information. And I think that's the journey that Path is on, and it's fascinating. Atul, your organization, and again, the same question, the impetus to drive this internal review and change process.
Thanks, Akhtar, and thanks for having me. And greetings, Janti. Always a pleasure to be with you and to speak, and Nikolaj, to get to know you in this community and in this line of work. I think just a quick opportunity, as you all probably know, we are 50 years. We were half the age of Save the Children, so we still have lots of lessons to learn, Janti. But we've, and our focus has been since our founding is really economic poverty elevation. How do you really look at fundamentally poverty being defined economically? What are the economic solutions, right? And we have sought to help the people we work with. We call them clients and not beneficiaries. For a reason, they deserve the same level of service and recognition as we do as clients here. Is to help them build incomes and assets, and do that by providing financial resources, training, and support. So in that, and you're obviously a global organization, multiple countries, millions of clients, we have gone through seasons of change in our 50 years, where we actually started fairly centralized, went to decentralized, went back to centralized. And now we've been in a season of decentralization, where, especially in the provision of financial resources, we are coming out of a season where we had a capital heavy model. We owned and operated banks around the world, believing that our purpose was to set up a banking sector that could effectively serve the poor where it didn't exist. And the only means to do it was to do it ourselves, right? So we raised capital and then we set up regulated entities around the world. I'd say probably in the last 5 to 7 years, and I'll give you examples of how it got exacerbated in COVID, we came to the realization that really our role was not the direct provision of capital. It was actually the release of local capital to serve the poor. But to make sure effectively, I call it that good capital serving good causes locally is what we realized we were about. And we came to that, actually we touched upon that earlier, Akhtar, out of a recognition of what our own strengths were, right? Our own strengths were to understand the needs of the clients on the one side and to develop products and services. And on the other side, to identify local partners who we could work with, who, given the right resources and the net and the framing and the support, would be willing to release and manage the local capital. The result of that has been that, frankly, it's been quite extraordinary. Is when we were doing our own banking services and lending, our philanthropic capital was multiplied about 5 times. So for every dollar raised, we could release $5 of loans. In the last 5 years, starting about 2015, as we started this decentralization process, that effectiveness has doubled. We now are able to, because we're working with local partners, releasing local capital, and we are providing them, minority equity, credit support, guarantees, things like that. We now multiply capital 10 times, right? Now, not only that, because we now have local banks who are running this and we don't have the burden of management, we then focused our efforts programmatically on providing wraparound services, skill building, capacity building, financial literacy training, business training, and things like that, education quality, how to improve. We do a lot of financing for affordable schools. How do you let proprietors run the schools better? How do you train teachers to do better classroom teaching? So the impact of moving to a locally driven model where effectively our local partners are doing the hard work of releasing capital and managing it. We now have more money going to serve the poor, and we actually are able to offer more services. And I'll pause at that, but those have been the twin impacts. I'll give you one quick example of what happened in COVID. I'll pick Ghana. One of your participants earlier, I think, was from Ghana. So I'll pick Ghana as an example. Is that our banking partner in Ghana, when COVID happened, traditional banks, tellers, people walking into branches and so on. Well, suddenly now nobody can walk into branches. Our banking partners realized, our local bank, well, people can still access their banking services on the phone. So they literally transformed overnight their branches into call centers, retrained their staff, and said, okay, now we are open for business. You can access your accounts through phone services. Ghana, like my native country of India, has multiple languages. We used to speak to our clients in principally 1 or 2 languages across the telewindow. Because you're on the phone, we went from 2 to 7 to 9 languages that clients could speak to their bankers in, right? And the result has been, literally the result has been at the end of COVID, we have more clients, we have more banking deposits, and in some cases we have more loans. So exactly the opposite of what you would have thought would happen, shutting down the economy and a detrimental effect. The opposite happened. Why? Because the local partner knew the local context and how to respond and could offer improved and increased services. So that's a bit of an example of what happens. I'll pause on the downsides. I'm sure you will talk about, what are the things to watch for. Yeah.
This is great. Thank you very much. It's fascinating to really kind of how your paradigm shift of releasing local capital rather than you actually becoming the capital provider became the impetus of driving this change that became scalable because of all of the services and the key advantage that Opportunity International had could really come into place. I greatly appreciate it. Well, when we were talking in the prep call, Janti had raised a very fascinating question, and I want to kind of pose this to all three of you. She basically, talked about that to get this kind of effort to be sustained, you need to shift a mindset and culture. And you kind of talked about, Janti, creating a shared purpose mindset. And obviously, for obvious reasons, I love the word purpose mindset just because I've written a book on it. But leaving that aside, it actually was very interesting for me that more than organizational tweaking that you obviously have to do, that you started working on creating that shared purpose mindset and culture within your organizations and with funders. So if the three of you can just talk a little bit about that in terms of how you managed to bring people along, both internally and externally, and especially the funders. And I'll go back in that same order with Janti.
Yeah, thanks. I think, look, and that's why I love that example that Atul just gave, because I think you have to recognize that there was a lot of power. I'm sure Atul also caught up in that. You provide the capital, right? Because God, all the power is then with the capital provider. And we have that same mechanism. If we are passing through funds from funders in the US or elsewhere in the global north to local partners, and then we put more compliance regulations even on that local partner, partly driven by our back donor and sometimes even of our own making, then that whole power dynamic is it's very imbalanced. And I think you have to start by recognizing that we have to give up some of that power, right? It doesn't mean it's a complete zero-sum game. I think you collectively get more power if you give some of it away. But with our staff, the award managers, the project managers, who feel that they had that power to decide what to do, where to fund, where not to fund, which partner to have a relationship with, you have to start there and recognize that is something that you have to give something up in order to get more back. And I think that's been the conversation that we've really started to have with people. Now, this is not an easy thing. So I'd be the last one to say we've created this sort of shared purpose mindset across 25,000 staff in Save the Children across 120 countries, right? Not at all. But that's where we're starting from.
Nikolaj?
Yeah, I think definitely just to pick up on that, the financial aspects and moving resources out, including decision power for budgeting and so on, to countries and local entities is essential. Unfortunately, money still is very important, and the symbol of it is also important, and the trust that we spoke about earlier, that it's so critical also in this. But I want to answer this question from another angle. So as we embarked on launching a new and developing a new strategy this year, we called it Path 2025. I mean, our strategic priorities are pretty clear what the organization is set out to do, which is prepare for emerging and respond to emerging health crises like the pandemic we're going through. There is a science and innovation aspect of it where we are improving lives with our vaccines, with our diagnostics, with our medical devices, and so on. And there is this aspect which we call increase health system capacity and resilience. Those are really our strategic priorities. But as we developed that, we said that's not good enough to say this is where we have capabilities to impact public health. We need to change the way we operate and our ambitions there as well. So we embarked on defining what we call change strategies, which is 4. So we have equity in health, we have community-focused priorities, respectful partnerships, and inclusive innovation. And I will not have time to go through all of those today, but just to name a few. So on the inclusive innovation, and actually parallel with this session, we're having our internal management meeting of the year, which you were part of as well as one of the speakers. And on the inclusive innovation, I just came out of that conversation. So as we do innovation in terms of new diagnostics to new medical devices, we are responsible for finding local partners, not only to bring them on early on in the innovation process, in the design, in the user user studies and so on from the beginning. But beyond that, that's not enough for us anymore. We need to also make sure, how do we actually create local innovative social enterprises that can actually take those products to to other countries, to other regions in their country, globally. So how can we help build that capacity, innovation capacity as well from our global networks in health? I think that's where the new paradigm shift is going to be as well. It's not enough just to include, it's also a responsibility for us to change that model and the way we have done innovation in the past. So another example is we're right now helping bring in mRNA technology to Africa by setting up these mRNA technology hubs. So that's where we're also supporting on innovation for a better future and more sustainable ecosystem of innovation. But that was just one example on the innovation side.
I love that, this whole aspect of, it's not just enough to include, but it is actually as much important to unleash the innovation practice. And the whole setting up the mRNA tech hubs in Africa is just that one step in allowing for local innovation to flourish and helping their capacity. I love that. Thank you so much for sharing that, Nikolaj. Atul.
Yeah, thanks, Akhtar. I'll try and answer it from, as an NGO leader, I've understood my own role in many ways to be, is in some different ways to be a stakeholder manager. Right, we bring together, NGOs bring together stakeholders from different domains, funders on the one side, clients on the other, in our case, partners, staff, boards. And I think the question, the challenge that Janti raises is very significant for us, because we, the people on this call, are truly uniquely accountable to manage all of those stakeholder relationships, and the change needs to happen in all of them. And that's what makes this job both hard and difficult, but at the same time, deeply satisfying when done well. The question you asked. So let me try and, I might not cover all, but I'll try and cover each of them. Is that, and there are different, each of these stakeholders have different needs and wants and aspirations. We're coming into this conversation. And I think when we look at our local partners and our staff in the field, I mean, it probably was borne out in your conversation yesterday, is that the transition there in their minds is, how do you go from being order takers of people giving the orders from the global north to now being truly owners, not only owners, but accountable to local communities to design programs, to deliver programs, and when they be accountable for results. So how do you make that transition even in your own staff, that they go from being order takers to now being designers and deliverers of local promises to local communities, and do that in partnership? That's not an easy transition. That's sort of in one place that I see actually happening increasingly across the nonprofit community in the global south. I would give us as a community very high marks on that. As an illustration, in my own organization, our head of global agricultural finance sits in Malawi, does not sit in our headquarters in Chicago or in DC or anywhere else. Our head of micro banking sits in Kampala, Uganda, doesn't sit close to my office. So, is an African. So those kind of changes are happening. When I go to the second stakeholders, which are, and you mentioned them, they're really important, is the funders. with funders, okay, how do you get them to change from the mindset of I, the funder, am making this change happen, and you, the nonprofit or the order taker, is going to make it happen for me, is to say, okay, the funders we are enablers of change to happen in the local space, right? We are not the designers and the deliverers of that change. We are not the owners of the change. We are enablers of the change. To have that mindset change, I see happening increasingly in funders, but there is a fair amount of work to be done there, I think, on that. And I think the onus is on us to build the funders' trust, not only in ourselves here as the parent organizations, if you will, in the US, but in our partner organizations in the global South. That you can trust them to do the work. And I think that is a area where we have to invest significant effort ourselves in both the enabling conversation and in the trust building conversation. One of your colleagues just said locally driven and globally connected. I love that phrase, and it goes back to that. Then I'd make it more personal to ourselves, to our staff and to our boards. We are answerable to our boards and staff. What do you do? What are you accountable for? And then how do you start to change that conversation to the metrics are not simply output and outreach. The metrics are outcomes, but those outcomes we don't own. Those outcomes are owned by a combination of the clients themselves, our local community partners, ourselves, and our funders. There's an interdependence in the ownership of those outcomes. And our job is to be the connectors and the enablers in that, right? And that conversation where the boards are looking to us to be directly accountable for output and outreach numbers, which has been the traditional metric, to now saying we collectively own outcomes, and here is our specific contribution towards achieving those outcomes, and then tracking and monitoring, evaluating, and reporting on them, if you will. Best practices. I could go into a lot more detail, but that's, I think, is a unique challenge that you throw up there, Janti, in that question, Akhtar. But it has to be answered in the context of how do you approach, each stakeholder approaches that. And our job as leaders in the international NGO community is to weave that tapestry of the stakeholders seeing their interests, current interests change to now more of a shared and interdependent interests. So it's we could spend hours on this, but I'll pause there. I could give you a couple of examples from my own organization, but I'll pause.
This is great. I mean, I as Atul, you were speaking, I was just trying to reflect on this change that is happening in a particular segment of the economy, which is also trying to shift.
Yeah.
Where we are actually moving from an economy based on attention seekers to the creator economy, right? There is the attention economy, which is basically influencers on social media, where people are actually drawing attention to themselves and monetizing it, versus the creator economy, where people are now using these platforms to create. And what you were actually talking about, this paradigm shift, the mindset shift from order takers to actually creating solutions, is a very big shift. So that's just fascinating to kind of look at how each of you are doing that. I know we have time for one more question to kind of get a sense of, and Atul, you kind of talked about it in your first answer, as to some of the challenges that you're facing. And maybe, Atul, you want to start off, and we'll go in the reverse order of some of the challenges that you're facing and how you're overcoming this challenge.
Thank you for that. I think in our own case, I mean, to be effective, to be locally driven, right, and globally connected, the principal primary challenge becomes finding local partners that you can work with effectively, because without those local partners, we are not going to be able to get very far. We then become dependent on our own selves to carry out the change that we are wanting to achieve in those communities. So for us, that is always, so which does mean, of course, to build a capacity, competency in finding partners and managing partner relationships and working with them. And that's what I found to be, one of the principal challenges. And some of the solutions that we've come up with is, okay, well, keep your, if you will, keep your promises, but make sure that there are just a few, right? And settle accounts quickly. These are cliches, but they happen to be true. And in some ways, agreed to more straightforward operations, a limited set of mutual deliverables, and connectivity, which goes much deeper than simply the deliverables, that you're truly walking together. So all of which leads to, frankly, programming needs to become far more simpler than it has been. Otherwise, you're not going to find good partners to do the work together. So it's one of those. I'll give you an example of a particular partner we have in India. They are healing fields in India. They are a community health, Nikolaj, in your space, organization that equips local women, and these unskilled, most of them illiterate women, in basic health skills, and then sends them out into deliver para health care in villages and communities around in eastern India. And we started working with them, and what we found was that, well, they were really good at what they were doing, but they had limited funding to grow their program. One. Two is that the women needed this program to be not simply delivery of health, but also an income generator. So we came alongside and we provided funding to increase the program itself. We actually connected with, in this case, Stanford Medical School to deliver, to train these women. Cloud-based services electronically on better health practices, para health practices, and then came up, that's what we are bankers. Well, let's come up with a model that actually lets you earn an income on doing this, and we'll give you loans to get started. So they went from having a few hundred women para health providers to having multiple thousands, right? And from thousands of families now to literally millions of families. But the essence of that partnership was both partners stuck to what they do well. They do the para health work well. We didn't mess with their work. We made it better. We do financing and capital provision well. We stuck to our work, right? But we found a way joined together. So I'd say that's where I'd leave you with is that's the kind of challenge you face. But I think if, like most other things, give yourself some objective and really work hard at it, and you start to find partners. I must say there are more and more partners. Last 3 years, we have gone from 65 global partners to 99, even through COVID. So can we find solutions to the challenges? Yes, we can.
That's fantastic. Thank you very much for that example, Atul. Nikolaj.
Yeah, that's a great example. I think related to that, one of the main challenges that I see is the pace of change, and especially the pace of change in terms of doing all of this in the middle of the pandemic. So as you could hear in my early remarks, we have done significant changes to PATH over the last 2 years, and I'm very mindful of how much the organization can cope with also doing a pandemic. But the good thing is that all our staff, my colleagues, are with us on the mission and with us on the change that we need to see. But the challenge is really doing it at the pace that we all want, because we're all impatient in terms of making this change. But with the pandemic, our resilience, and we are all feeling it, it's hard to manage more during these hard times. So that's one challenge. Another challenge, which I think as well Atul talked about, is the patience in terms of and the resources to actually invest in finding more local partners, doing the landscaping, because this, for organizations like us that are working in a grant model where you get a budget to execute a specific project, there's not necessarily always time to actually do a landscaping to figure out, should we be partnering with 3 new local entities in this specific project? So we need to become better at actually saying, stop to the donors as well and say, could we actually include a bit of landscaping or a bit of more inclusive innovation and finding local partners in this specific project, rather than, saying yes to all the, the timelines and budget issues that are raised, or budget for envelopes that are given at the onset. So we need to, but I think we have a chance. I'm an optimist here, so I think our sector is moving in that direction. I think the time is now. So we feel that we have some of our strongest partners and donors with us in this journey. We just need to work maybe even closer together to make that transition happen.
Thank you very much, Nikolaj, for that. And I love this notion of how to say a meaningful yes to the donor that allows for this inclusivity and this inclusive innovation that you're talking about, which actually allows you to have a pause in terms of how you want to, really understand the landscape in which you want to function in. So thank you very much. Janti, last thoughts, your thoughts.
Just to echo, I think pace, definitely, again, and sometimes I ask myself, well, how much more can a, 25,000 staff, $2 billion across all these, how much more change can we do well at the same time, as we are also literally addressing, real-time sort of life-saving sort of interventions we're handling multiple conflicts and crises at the same time on top of a pandemic, right? So sometimes I have to ask myself, okay, so maybe we should pause, but then I'm thinking, no, we cannot pause. We have to speed it up because of actually all of those crises, because we cannot control it all from DC or London or wherever. So I think that impetus needs to change here. So I think pace is a real thing. I think finding local partners to absolutely. We have about 1,300 partners globally, but only half of those are real sort of locally led partners, civil society organizations, etc. So we need to, and the fact that I actually know that number now is to some extent progress, I would say, but the level of and the depth of those partnerships, and then finding time and local leadership to develop those partnerships over time and seek them out is important for us. And lastly, I would say the incentives in this system are still sometimes really working against this. Even within our own sort of board and governance systems, and sometimes by our donors, as long as we just keep talking about income and revenue and make that a leading, and I've stopped, I've said this to my board, I will not lead with income when I talk about performance of the agency. We cannot, because if we do that, then I think you're sometimes working against what you're trying to achieve. You have to be proud of losing a bid to a local partner that we have worked in for years and who is now priming, for instance, on a particular large opportunity. We have to be proud of the fact that we are no longer doing food distribution in refugee camps, but we have handed it over, and it is now cash transfers directly to local, to the people that we serve, and they have cash with which they can have dignity and choice in local shops and in the local economy. And we are sort of out of the picture, frankly. Maybe we do a little bit of baselining on nutrition for kids in a particular case, but that is and that is not very much reflected in the top line, but it is reflected in the outcomes of the intervention.
Thank you very much. This has been such a fascinating conversation. And between these two conversations we've had, I really want to appreciate the three of you for giving us the time and your insights. And I also want to kind of, thank Global Washington for putting these two panels together, to our colleagues from yesterday for also providing such rich insights. And with that, I thank you all very much, and hopefully, Atul, Janti, Nikolaj, you will continue to succeed in what you're doing. We love the work that you do, and hopefully we will catch up soon.